medical device we will be discussing is the contact wearable electrocardiography, which is often simply referred to as wearable ECG. The startup company we have built is ECGenesis, which is termed for the growth and regulation of ECG technology. So to begin with, what is ECG and what is wearable ECG? ECG is a tool or device that is used to measure the heart rate of individuals to detect any irregularities or fluctuations in the heart rhythm. This tool can detect abnormalities such as atrial fibrillation by measuring the intervals between heartbeats. Traditional ECG devices are what we're most likely familiar with. It is used in almost all hospitals and clinics. A more advanced derivative of this device is the contact wearable ECG device we will be discussing further. Although traditional ECG devices were introduced in the 1900s, wearable health devices are a fairly new technology that has still not been exploited completely. Being revolutionized throughout the past few decades, wearable ECG devices have shown to be far more convenient than the traditional devices. This is because wearable technology is not limited to just the hospital setting. It can be used anywhere at any desired time of the day. Nevertheless, it should be noted that wearable devices are not capable of detecting blood clots, strokes, and related conditions. Overall, it is not as accurate as the traditional ECG device and should not be used for complete diagnostic purposes. It serves more as a great initial stage monitoring technology, and any irregularities should be consulted with a physician. Wearable ECG devices are preferred and implemented due to their constant monitoring of heart rates, especially during the pandemic when people cannot physically get a physician consultation or cannot afford to get one. Hence, through a startup like ECGenesis, we're hoping to provide all individuals with the ability to monitor their health. Essentially, these devices use biosignals and sensors to function as a completed circuit to generate the output on the monitor. Biosignals such as the ECG signals and PPG signals, and sensors such as the nanosensors and heart sensors will be further discussed. Furthermore, unnecessary noise signals are controlled through the use of discrete wavelet transform. The output data produced after processing these signals are displayed as sinus rhythm, atrial fibrillation, heart rate, and inconclusivity yield. To bring this idea to the market, ECGenesis would first have to undergo testing and successfully clear the stages dictated by the FDA. To receive the medical device user fee amendments for a Class 2 device such as this, a pre-market notification, pre-market approval, investigational device exemption, and quality system regulation are needed. A closer look will be taken at these topics, and the regulations and safety processes needed will be further discussed. Technological advancements of wearable ECG. Electrocardiogram has found its way into every hospital and now almost every home, but it wasn't until the early 1900s when the ECG was actually tested on humans. As early as 1842, Dr. Carlo Mattausi showed that an electrical current accompanies every heartbeat with a frog model. This was the basis of the first ECG using a capillary electrometer, and electrodes was placed on the chest and back of a human. New advancements then led to the first string galvanometer, which recorded the potential difference between the extremities. The picture shown on the left is the first human ECG recorded by Dr. Waller in 1893. The figure shows the readings from the ECG, which is essentially the electrical activity preceding each ventricular contraction or heartbeat. Following this, further development has introduced what is now widely known as the 12-lead electrocardiogram. It wasn't until 1978 when Dr. Michael Morawski used ECG technology to detect abnormal changes in the heart rhythm. The wearable ECG devices combine aspects from the traditional device and wearable health device industries to provide convenient and continuous monitoring of health. The major benefit of this technology is its capability of timely medical intervention. As said earlier, when traditional ECGs have been administered at hospitals, wearable ECGs can be used at any time of the day to get a quick reading of heart rates. In addition, it also provides regular feedback and early detections. Wearable ECG monitors are currently manufactured using a wide range of products, but the two most popular of these are watches and wearable patches. The watches have ECG monitors built in, and the patches are wireless stick-on patches that contain electrodes to transfer electrical signals. Need for device and implementation. Traditional ECG devices, as described previously, have existed for a longer period of time than wearable ECG monitors and hence have been studied more thoroughly. ECG devices help detect irregularities that cause arrhythmia, coronary heart disease, heart attack, and cardiomyopathy. They also help detect if an individual has had a previous heart attack. Then, what exactly is the need for wearable devices? The answer to this question lies in the factors of affordability, accessibility, convenience, and early detection. Wearable technology immensely decreases concern in individuals, since symptoms of heart abnormalities include common symptoms such as chest pain, dizziness, lightheadedness or confusion, heart palpitations, rapid pulse, shortness of breath, weakness, fatigue, and decline in the ability to exercise. Regulating heart rate can be useful in decreasing anxiety and concern in individuals, and especially those who have had previous heart failures or diseases. Furthermore, American Heart Association does not recommend getting an ECG test for people who show minimal to no symptoms because any false positive will lead to the individual undergoing more invasive tests. Wearable ECG devices can significantly reduce the risk of such false positive results. It also helps with the early detection of heart irregularities because it constantly monitors heart rate, allowing the individuals to be aware of any slight changes or fluctuations immediately. Some physicians also recommend the use of wearable devices because symptoms that occur periodically cannot be detected by traditional ECG devices, but the individual can monitor them through the wearable ECG devices. However, it does pose some disadvantages and limitations. Because it is a new technology, its level of sophistication is lesser than that of traditional devices and hence can be less accurate. More importantly, individuals will have to understand the extent to which wearable technology can be used to make decisions. By this, I mean that since there is no expert like a physician guiding the individual in analyzing heart rate changes, they will have to judge certain false positives and false negatives for themselves. For instance, when the individual is exercising, the heart rate will evidently be higher than during normal breathing periods, so they cannot consider this as a major irregularity. A lack of understanding of this concept can sometimes lead to premature testing. The anatomy of ECG. The heart contains two types of cells, autorhythmic cells and contrastile cells. These together are responsible for the initiation and action potentials and pumping of blood through the heart. The autorhythmic cells always maintain pacemaker potential by slowly depolarizing the membrane potential until threshold potential is reached, when an action potential is then triggered. The action potential then spreads along the cardiac muscles to propagate the movement of electrical signals. An action potential is the increase in the membrane potential that is used to generate an electrical signal. Three phases are depolarization, prepolarization, and hyperpolarization. The potential is changed and accordingly maintained by the opening and closing of protein channels such as K+, Na+, and Ca2+. The electrical signal initiates at the SA node and spreads to the AV node in the right atrium. Once it is spread to the atria, it is then received by the bundle of His and travels down the Purkinje fibers to spread throughout the heart. The sum of these signals at a given time is read by the ECG. These processes form what is called the PQRST waveform as shown in the figure. The wave basically consists of three major parts: the P wave, which is the atrial depolarization, the QRX complex, which is ventricular depolarization, and the T wave, which is ventricular repolarization. Between these lie the PQ segment, which represents the AV nodal delay for complete depolarization before ventricular filling, the ST segment, which represents ventricular contraction and emptying, and the TP segment, which represents the relaxation of the ventricles. The figure shown on the left shows the pathway of electrical impulse through the heart, starting with SA node, then through the AV node, through the bundle of His, and finally through the Purkinje fibers. Pathophysiology usually occurs due to abnormalities in the pacemaker activity regulated by the SA node. Once an action potential initiates at the SA node, it will follow the fastest rate of autorhythmicity, which is approximately 70 to 80 beats per minute. However, if this node fails, then the activity will continue at the rate of the AV node rhythmicity. Complete heart block occurs when the connective tissue between the atria and the ventricle become non-functional, so the atria function regularly while the ventricles follow a slower pace assigned by the Purkinje fibers at 30 beats per minute. On the other hand, an ectopic focus occurs when the Purkinje fibers become overly excitable and create an abnormally high impulse. Lastly, ventricular fibrillation occurs when multiple impulses initiate at the same time and travel in different directions simultaneously. Although the pathophysiology of the heart can cause other problems as well, I focused on these three because they have the greatest effect on the ECG output data. Metrology. As mentioned before, two popular types of wearable ECG technology include watches and wearable patches. While they're both contact technology and function using one lead or electrode, the main difference lies in the way they work. As the name suggests, one is a built-in monitor on watches, while the other is a stick-on patch that sends signals to mobile devices. The ECG monitor watches also contain an automatic health report generator. Similar to the watch, the wearable patches analyze atrial as well as ventricular rhythms such as pulses, premature atrial contractions, and premature ventricular contractions. So now that we have understood what ECG is and what wearable ECG is, let us turn our focus to how wearable ECG devices actually work. The basic methodology of wearable ECG device consists of a single lead electrode, a heart rate monitor, and sensors. The heart rate monitor uses LEDs to detect blood flow by penetrating the skin layer. Some of the recently FDA-approved models include remote patient monitors and remote patient interval monitors, both of which are administered in hospitals. These record changes on the QT interval of the previously described PQRST waveform. One major difference it poses in comparison to the wearable ECG devices is that it cannot be used in a wide range of settings. Use of biosignals. Biosignals are used for continuous monitoring of heart rates. Two signals measured in wearable ECG devices are ECG signals and PPG signals. ECG signals utilize the PQRST waveform to deliver outputs like cardiac outputs and blood pressure levels. On the other hand, PPG signals utilize the PPG waveforms or the systolic and diastolic pressure phases. Since the systolic and diastolic pressures in the venous and arterial blood systems regulate in a patterned form, PPG waves can be used to capture the time between each heartbeat. The figure shows the phases of systolic and diastolic blood flow, which is graphed against the time in the bottom waveform figure. This can be employed to determine changes in blood volume or flow over a certain period of time, which can consequently help in producing the output of a heart rate. Use of sensors. Sensors are essentially devices that read inputs from external stimuli such as light and temperature. Wearable patches usually use nanosensors and implantable sensors so that the electrical signals can be generated and transferred from the patches. Contrastingly, ECG monitor watches use optical heart sensors, also known as PPG. Since blood is colored due to the absorption of green light, the light sensor is paired with LED-sensitive photobodies to track the absorption of this light. This way, the blood flow per unit of time can be measured. When the heart beats, the blood flows without any airway resistance, so the absorption of green light will be high. And between heartbeats, the flow will be stopped or controlled, so that the absorption of green light will be low. In addition to these sensors, ECG monitor watches also have touch-sensitive buttons that work as a completed circuit. When the button is pressed, an electrical circuit is conducted between the heart and the arms, which enables the electrodes to output the heart rate. The figure on the right shows the different sensors and electrodes present in an Apple ECG monitor watch. Besides current technology, New innovations and studies are hoping to benefit from the use of dry electrodes and graphene-coated electrodes as they provide a higher device-to-skin contact and visualization quality.